Do you have congestive heart failure, a liver disease, a kidney disorder, or are taking medication to help treat edema, but it doesn't seem to be working? Or do you have high blood pressure and nothing seems to help? Ask your doctor about furosemide.
Furosemide, or Lasix, is a loop diuretic that helps the kidneys remove extra fluid from the body by preventing too much absorption of salt and water. This can help improve edema in the legs, feet, and other areas, as well as lower blood pressure through the effect of having less salt and water in the body and blood vessels. This will cause frequent urination.
3:28 a.m. 12 seconds later. A few moments later.
Unlabeled uses of Lasix include hypercalcemia with malignancy, hypertensive urgency, pulmonary edema, or hemodynamic effects associated with blood products, transfusions, or ascites.
Lasix can be taken orally as a pill or in liquid form. Lasix can also be administered through an IV or injection. Before taking Lasix, assess for any abnormal electrolyte and lab values, serious rashes, hearing deficits, allergies, abnormal respiration and lung sounds, hypertension, and pregnancy. Do not confuse Lasix with Luvox, Lomotil, Lanoxin, and Losec. Do not take Lasix if you have anuria or cannot produce urine. Avoid over-the-counter medications unless it is directed by your prescriber. Take Lasix in the morning to avoid interference with sleep if using as a diuretic. While taking Lasix, a high potassium diet or replacement is recommended. If you are feeling nauseous, you may take it with food, but doing this may decrease the effectiveness of the medication. If at risk of aspiration, you may crush the pill. Rise slowly from a lying or sitting position to prevent orthostatic hypotension from occurring. If you have any adverse reactions such as muscle cramps, dizziness, weakness, numbness, nausea, or rashes, please notify your doctor.
When taking Lasix orally, you will begin to feel the medication working about 1 hour after administration. The peak time is 1 to 2 hours and is effective for 6 to 8 hours. It is important to not overlap dosages. IV administration works immediately, but is a shorter peak time of 30 minutes. Its effectiveness lasts about 2 hours.
Take precaution if you are pregnant, breastfeeding, giving to an infant, have diabetes, severe renal disease, ascites, hypersensitivity to sulfonamides, hypovolemia, electrolyte depletion, and if you are experiencing dehydration.
Common side effects of Lasix are hypokalemia, hyperchloremic or alkalosis, hypomagnesemia, hypocalcemia, hyponatremia, hyperglycemia, hypouricemia, nausea, polyuria, rash, and pruritus.
Life-threatening interactions will occur if taken with lithium, non-depolarizing skeletal muscle relaxants, digoxin, salicylate, aminoglycosides, cyplastin, and vancomycin. Notify your doctor if you are experiencing any of the following life-threatening side effects, such as circulatory collapse, renal failure, thrombocytopenia, arugulosites, leukopenia, neutropenia, anemia, toxic epidermal necrolysis, arrhythmia multiforme, and Steve-Johnson syndrome.